This is what many people never fully explain. People always wonder why the body bleeds during menstruation. This is not an accident or a sickness. This is the truth no one will tell you. Watch till the end. Menstruation is the physical result of a hormonal decision made inside the body. It happens when an egg that was released during ovulation is not fertilized and no pregnancy begins. Once this decision is made, the body begins a controlled process to clear what is no longer needed. The process starts with the egg. During ovulation, one mature egg is released from the ovary into the fallopian tube. This egg does not travel randomly. Tiny hair-like structures inside the fallopian tube gently move the egg forward, hoping it will meet sperm. If fertilization does not occur within about 12 to 24 hours, the egg begins to break down. It does not cause bleeding and it does not leave the body. The egg is simply reabsorbed naturally by the body without pain or awareness. Once the egg is no longer viable, the body shifts its focus to the uterus. Before ovulation, estrogen caused the uterus to build a thick, soft lining filled with blood vessels. After ovulation, progesterone held this lining in place, keeping it stable and ready to support pregnancy. When the egg is not fertilized, the hormone-producing structure in the ovary, the corpus luteum, stops working. As a result, progesterone and estrogen levels fall sharply. This hormone drop is the trigger for menstruation. Without progesterone to support it, the uterine lining loses its blood supply. The small blood vessels in the lining tighten and collapse. This process cuts oxygen and nutrients to the tissue. As the tissue begins to break down, the lining separates from the uterine wall. This separation is what causes bleeding. The blood seen during menstruation comes from broken blood vessels in the uterine lining, not from the egg, and not from injury. The uterus is a muscular organ, and once the lining begins to detach, the uterus contracts rhythmically to push the contents downward. These contractions are similar to mild labor contractions and are the reason some people feel cramps. As the lining breaks apart, it becomes a mixture of blood, mucus, and uterine tissue. This mixture collects inside the uterus and begins moving toward the cervix. The cervix, which is normally firm and slightly closed, softens and opens slightly during menstruation. This opening allows the menstrual flow to pass from the uterus into the vagina. Gravity, uterine contractions, and abdominal movement all help guide the flow outward. Menstrual blood does not flow continuously like a tap. It moves in waves, responding to muscle contractions and body position. This is why bleeding may be heavier at some times and lighter at others. The vagina serves only as a passageway. It does not create menstrual blood. The blood exits the body through the vaginal opening and is absorbed by pads, tampons, or menstrual cups. During menstruation, the body also releases natural substances called prostaglandins. These chemicals help the uterus contract and shed the lining efficiently. High levels of prostaglandins can increase cramping, nausea, or diarrhea, while lower levels result in milder periods. Bleeding usually lasts 3 to 7 days. As the uterine lining is fully cleared, bleeding slows and stops. Once the lining is gone, the uterus begins preparing for the next cycle almost immediately. It is important to understand that menstruation is not the body cleaning dirt. It is the body completing a cycle. The egg that was released has already been reabsorbed. The bleeding is solely from the uterus shedding its lining. Menstruation continues month after month from puberty until menopause. Each cycle reflects how well hormones, nutrition, stress levels, and overall health are balanced. In simple terms, menstruation happens because the body prepared for pregnancy did not receive the signal to continue and responsibly resets itself. It is not a failure. It is a function precise, controlled, and essential to reproductive health. If you found this educational and exciting, please subscribe, like, and comment your thoughts below. Tell us, what part surprised you the most?